Hi everyone, Trevor Petrie, certified hand therapist here. I am going to talk to you today about heat versus ice. Which one is right for you? Um, it's a question I get a lot from a lot of my patients, at the end of the day, there's a fairly straightforward answer, but I don't want to spoil the ending yet of my talk. So let me give you some background on what heat and ice do specifically and how they might help you. So first, heat. Heat is going to dilate all the blood and lymphatic vessels in your body and create more blood flow to an area, generally speaking. That's going to increase the elasticity of the tissue because there's just more hydration of those tissues so they can stretch a little bit more before you cause trauma. So that being said, heat is generally going to be good before you do an activity or to loosen something up. And then ice is going to have the opposite effect. It's going to constrict all of those vessels. And so what that's going to do is that's going to restrict blood flow to an area. So if you're having an inflammatory response, ice is going to be good to keep those inflammatory agents from getting to those tissues involved so you don't further that inflammation. So very simply put, speaking very broadly, what I tell people is heat before an activity if you're able and ice after if needed, or heat if you're stiff, ice if you're sore. Now, there's a little more nuance than that. One of them is that there is a fairly nerdy debate amongst certain therapy circles about how much heat and ice actually do. Your body is really good at controlling its internal temperature, generally speaking. And so external heat and ice sources aren't really going to permeate really deeply into your body. It's up to maybe a centimeter, maybe a centimeter and a half or so at most in a healthy body with a healthy circulatory system. And so if you're trying to heat up really deep structures, so say you've got like tennis elbow or something like that, or the muscles in your forearm are aching, or you may have been told by another practitioner that heat and ice don't really do a whole lot for, say, your back, or if you've pulled a hamstring or something like that. That's the reason behind it, is because of this belief that the energy won't get that deep into that tissue, which has created some confusion in my practice before when I tell people heat when you're stiff, ice when you're sore. The other thing at work here is that I don't always heat or ice people mainly because of the physiological process that's involved. Heat will also take you out of a guarded sympathetic state, which means that if you've got a high tone signal to your muscles because something is sore or injured, your muscles are going to be very tight, which isn't going to allow you to move normally as you are supposed to. And so if you put a heat source on it, even if it's something like a deep structure, like something in your back, or, like I said, hamstrings, big muscle group, something like that, that can still help everything feel better because it's just generally loosening everything up, taking you out of that sympathetic nervous state, getting that guarding response down, getting that muscle tone down, and relaxing everything out. So there's a neurological process that's involved with heat and ice as well. Ice, if you're very sore, is also a topical analgesic. It makes things numb. And if things are numb, they hurt. And so if you're very actively, acutely inflamed and sore and you put an ice pack on it, that's going to numb it out. And what I always tell my patients or people that, care to listen to me, is that if you feel better, generally speaking, you'll move better. And if you move better, your body is going to be able to adapt and heal better. And so at the end of the day, what I always tell my patients is do what feels best. If I've had people with, say, osteoarthritis in their thumbs that will tell me that ice feels really good. Now, the majority of the time I tell people, yeah, you probably don't want to ice with osteoarthritis for a very similar reason that teeth with the enamel worn down don't like ice. There's not as much protective layering in that joint space. And so it feels pretty aggressive and painful. But if you're one of those people that try an ice pack and you come in and say, hey, ice feels really good though, I'll say, great, keep using ice. So the very, very simple answer for this very long-winded explanation as to whether to heat or ice is simplified. It's heat when you're stiff, ice when you're sore, or heat before, ice after. And an even simpler explanation is do whatever feels best. You want to be aware of some certain precautions. You don't want to have a ice pack that's too cold on your skin for too long. If you have any kind of nerve issues or anything like that, you want to just make sure you keep checking your skin to make sure you're not creating any tissue trauma that you're not aware of because, say, your fingers or something are numb. But outside of that, if something is feeling good, keep doing that because most likely it's going to allow you to A, move better, and B, it's going to allow you to do the things you want to do. I hope that helps. If you guys have any questions, as usual, I'll be sort of on the web page to answer any questions you might have, or you can always just message me directly through Grace Enable, Trevor Petrie, certified hand therapist. And otherwise, keep moving, stay healthy, and take care of yourselves. All right, thank you.